let's speak now to forensic psychiatrist Dr. Soham Das. Dr. Das, let's start with the victims. They have experienced something utterly horrific. Aside from their physical injuries, what will they be going through mentally now?
Well, I think anybody who is the victim of such level of trauma might suffer something like post-traumatic stress disorder. So that's when the individual relives the incident over and over again in their minds, either in the form of flashbacks, nightmares, feeling hypervigilant, which means that they're always on edge. And sometimes that can last for years. Then they often get things like anxiety, depression. Sometimes they feel anger and guilt themselves. But I think what's specific to these kind of corrosive acid or alkali attacks is that it can also cause disfigurement. So that can impact them in the long term. Social isolation, issues with self-esteem, body image, can even lead to a loss of identity. So there's almost like an extra layer, I believe, compared to any other form of attack or assault.
And it's just so cruel to use a liquid like an acid or an alkali. We were talking earlier about the fact every time you look in the mirror, for example, you're reminded of the terrible incident and the trauma that you have sustained. Can I just ask you, with your psychiatrist hat on, what sort of person would do that, would throw acid or alkali? What does it say about their pre-morbid state?
Yeah, that's a great question. I think it says a lot about them, really. I mean, obviously, anybody that will inflict so much pain on an individual, especially as vulnerable as two young children, has extreme rage. They have hatred. But I think there's something specific about using a corrosive substance, which is, I think, about jealousy and envy and possessiveness. And obviously, we don't know enough yet about the dynamic between the perpetrator and the victims. But if I was speculating, I think there's a reasonable chance that there is some sort of jealousy or envy. Maybe he feels rejected. Maybe he's got some stalking tendencies. But as you say, David, there's something very, very personal about it. It's not just trying to upset them or attack them. It's trying to damage them permanently.
Yeah, I saw one victim of an acid attack describing this as wiping her identity because of the damage, the permanent damage that it does to your looks. We heard from Andreas Christophorus, another acid attack victim in the last hour here. Incredibly powerful testimony. But what really struck me, Dr. Das, was that he said he would rather have been shot or stabbed than have had acid thrown at him. Such are the lasting implications of this kind of injury.
Yeah, I mean, as we're all saying, it's so permanent, isn't it? You get a reminder every single day, every time you look at yourself in the mirror. If there is significant disfigurement, then it changes your identity. You are no longer you no longer have the kind of abilities and looks that you had before. You probably get little stares almost on a daily basis when you walk past people. So it changes your entire. It's not just one thing that's happened to you on one occasion that you might have flashbacks about. It changes your entire presentation to the world. And there's something very, very twisted and evil and damaging and destructive about that act.
And it's really difficult for you to comment on this particular case, but how much of this do you think, and I don't know whether you can actually answer this, how much of this do you think was premeditated? Would you expect there to be an underlying mental health issue? Or is this, as you sort of mentioned earlier, is this a revenge attack? Is this about control? We talked earlier about it tends to be men that commit this over women. Your thoughts on that?
Sure. Well, as you say, I struggle to speculate on this case because I don't know the details. But if we take these kind of cases in general, then it is by far most commonly carried out from men towards women. And I think this is a form of social control. I think it's dominance. I think it's misogyny as well. And as to the question about whether it's pre-planned, I mean, it has to be to a degree, right? It's not to actually obtain these substances in the first place takes some effort. You either have to have access yourself or probably more likely you're embroiled or connected to the criminal underworld to be able to get your hands on these substances in the first place. It's not just something that was done impulsively and decided that particular morning or that particular day. It was something that takes a degree of pre-planning and malice aforethought, I think.
So, thank you very much indeed. Thank you to Dr. Das there.